Hello everyone. My name is Pat Huckabee and I'm the Senior Ambassador at Monarch Healthcare. Monarch Healthcare is a large medical group of over 1,500 physicians. We are the primary care doctors and specialists that partner with your HMO plans to keep you healthy. You can think of me as a go-between between you and your physician, helping you to navigate any special situations you may encounter. For instance, you may have an authorization to see a specialist, and when you call, you can't see the doctor as soon as you would like. You could give me a call, and I could see if there would be someone that could see you sooner. Today, we're going to have another health topic, and it is the ABCs of diabetes. All of us know that diabetes is one of the most diagnosed problems in the United States, and we hear a lot about it, especially among adults and children. And the doctors, health plans, and medical groups like Monarch are setting it as a very high priority. So we thought we would talk about it today and let you know also what we do out in the community to educate people and on the phone, and what is available to our members who have diabetes to help them to take care of themselves and to learn more about it. So today our guest is Debbie Eastman. She is one of our nurse case managers and certified diabetic educator, and we have several of those, and they are available for our members. So it's somebody I think it's important for you to meet today. And I just want to welcome Debbie.
Thank you, Pat. I'm very glad to be here.
Great to have you. So Debbie and I have been out in the community together, and she's been educating and bringing her knowledge out there. And so today we're going to bring it right into your home and let you meet her here. So we call this the ABCs because actually a lot of these points follow the alphabet, don't they? And
yes.
It's a good way to remember it, huh?
Yes.
Yeah. So we're going to start with A, and I'll let Debbie take over. Why? First of all, we're going to have our, let's see, we've got our slide up. So why do people living with diabetes need to both have this finger stick? I know I hear people, some of them having problems to do that testing, and the hemoglobin A1C. Why do they need both on that?
Well, Pat, these tests are important for people living with diabetes so that the doctor, the certified diabetes educator, or anyone who's trying to help with managing medications, managing diet and exercise, will have a roadmap as to where the patient's blood sugar challenges are. Starting with the A1C, which is the A in the alphabet, the A1C stands for a test that the doctor has drawn at the laboratory. It's called the hemoglobin A1C, and it's a test of the patient's average blood sugar over the course of 3 months' time. So you might have an A1C of, say, 12, and an A1C of 12 is an average blood sugar of 298. So that means if you took your blood sugar 20 times over the last 3 months, maybe you'd have blood sugars that were 398, and maybe you'd have blood sugars that were 150. But when we average it together, the average over 3 months is 298. The ADA recommends that we have an A1C under 7. And under 7 is an average blood sugar of 154.
Nice.
The American Association of Endocrinology, they're called ACE, AACE, they recommend that we're under 6.5 for our blood sugars, and that's an average of 140. So the reason finger sticks are also important is that one time every 3 months doesn't give us a clear picture of what your blood sugar is doing after you eat. For instance, you might have an average blood sugar of a 140, but after you have a meal with quite a bit of carbohydrate in it, maybe your blood sugar is up at 250 for a while. And that can be dangerous. Anytime your sugar is up over 200, we start to worry about all of the terrible things diabetes can do to your body. So finger sticks are very important.
I see. So you need that daily thing as well. Yeah.
Yes,
It's how
daily.
your body is processing the meal.
Yes.
That's what you want to know from that daily.
Right.
those daily.
You're at your mealtime, what raises your blood sugar is the carbohydrate you're eating.
I see.
There are several different types of carbohydrate that I'll be talking about a little later.
Yeah. So we'll be going through that. So okay. So we did the A part. We started with that. And how often does the doctor do that hemoglobin usually?
The hemoglobin A1C is usually done at least every 6 months.
Okay.
If your hemoglobin A1C is over 7, or if you're over 65, if it's over 8, then the doctor will be doing it every 3 months.
I see. So it just depends.
Yes.
Yeah, on those things. Yeah. Okay. So now let's see. Now we got B. We can talk about B and. Why is it important for people living with diabetes to control the blood sugar, or the blood pressure rather?
Yes, the B stands for blood pressure. It's very important for people with diabetes to control their blood pressure, because people with diabetes are twice as prone to heart attack when they have high blood pressure as people without diabetes who have high blood pressure.
I see.
And lowering our blood pressure by just 10 points can lower our risk of heart attack by 11% and our risk of stroke by 18%.
Wow.
So we who are diabetic want to make sure that our blood sugars are under 130/80. Blood pressure measures when your heart is beating, there is pressure on the walls of your arteries that are created from the force of the beating heart. And the blood, when it rushes through those arteries, the arteries are meant to expand and contract. And as they do, it keeps the blood pressure down low. So when our arteries start to get a little hardened, then that's when we start to have problems.
Smaller, the place that
Smaller
the blood is-
diameter of
Yeah.
the arteries kind of make it more, instead of a flowing river, makes the blood more like a raging river.
I see.
And the systolic blood pressure, which is the top number, is the measure of the pressure of the arteries on the walls of, or I mean the blood on the walls of the artery when the heart is beating or pushing, and when the heart relaxes, that's the diastolic number, or the number on the bottom. Should be the lower number.
I see. So, of course, the numbers are going to be a little different for a diabetic than for an average person, is it? Or is it about the same?
No, they're about the same.
Okay,
Yes.
all right. So you don't have to shoot for something even
No,
even lower.
don't have to do more than the average
Yeah, the
bear.
average person.
But we are more prone to having high blood pressure, so
Yeah.
we do need to watch it.
Just watching it, yeah. And okay, and then what about the C? I mean, that really, B and C with blood pressure and cholesterol, something all of us have to look out for. So how is that controlled? And
Okay, C
affecting-
stands for your cholesterol. So it's
Yeah.
important for people living with diabetes to monitor cholesterol. So cholesterol is basically a sticky fat that circulates in your bloodstream. And there are two different kinds of cholesterol. The LDL, which is the cholesterol that's considered bad, is we are wanting to keep that number under 100. When the doctor has the lab drawn, it should be under 100. The reason that cholesterol is considered bad is that is the type of cholesterol that tends to damage your arteries and start to cause your
The
arteries to
clogging.
harden
Yeah.
and to start to, when the breakdown of the wall of the artery happens, inflammation starts, and then the LDL starts to pile up on that inflammation, that area of inflammation. So you end up with a hardening of the arteries, as well as you end up with atherosclerosis, which is the buildup of the cholesterol. So the way that I remember it, is there's a little tip I use, and so LDL I consider the lousy cholesterol. So I can remember which one's bad and which one's good.
That one has to be low.
That one has to be lower, under 100. The HDL is the happy cholesterol. It's the good cholesterol.
Yeah.
And that cholesterol, what it does is it grabs a hold of cholesterol's, the bad cholesterol particularly, it takes it back to the liver so it can be processed out of your body. Now, cholesterol is not just produced by what we eat. There are foods that we can eat that can raise our cholesterol, but it's also produced in the liver. And people can be more genetically prone to producing the bad cholesterol.
It's like something we can't do anything about.
That's
it's
right.
Just the way
For some people, genetically, yes.
Yeah. So again, you know, some of us with higher, you know, when the doctor feels it's necessary, we'll get some medication or something.
Yes, medication helps with when you can't control your bad cholesterol with diet and exercise. Then the doctor will look at prescribing medications for it.
I see. So that's something, at least it's something all of us have to work on. It's not just, in this case, it isn't just the diabetic that has to work on.
For both the B and the C, it's everyone.
Right. And I just wanted to point out that these nice, I don't know if people can see it on the desk, but these nice flyers that you're holding here with the orange stripe, and I think everybody recognizes Monarch's color there with the orange stripe. These are available for you. And one is on blood pressure, right?
Yes, this one's on blood pressure.
On cholesterol.
This one's on cholesterol.
Okay.
We have them for various health topics.
Yeah.
Your eyes, your diet.
And the A1C?
The hemoglobin A1C. There are several different forms.
So I'm going to say this now, but I'll remind you about it, that I would be happy to, if you want to call me, I can mail you these. Debbie's brought enough. I can always get more. I can mail them out to you if you're watching today and would like copies. Or you could come and see me at the Florence Sylvester Senior Center on the first Tuesday of every month at 10 o'clock. I'm there for my chat with Pat. So I encourage you, I will be bringing them with me, and I'll have some for you. So we want to make sure they're really excellent.
Yes, they are. They're full of
out,
information, yes.
Yeah. So let's continue now. We've already done A, B, and C, and now we're getting into D, E, and F. Let's see. Oh, here, he was just showing something. So here's the D,
yes,
E, and F. Here.
We're doing the D, E, and F.
Okay.
So with the D, we first come to dental care.
Right.
And everyone, as you probably know, we all have bacteria on our teeth, and that bacteria interacts with the foods that we eat and creates something called plaque. And plaque builds up on our teeth. When that happens, our gums get swollen and inflamed and infected. And they have found that this inflammation can go throughout the body and cause us problems, or cause us to be more prone to what we talked about the cholesterol, having inflammation within the blood vessels, having heart problems. So having our dental care is very important. In addition, for people with diabetes, the sugar being higher creates the perfect environment for bacteria to grow. So the higher our blood sugar is, the more prone we are to dental disease. So if you do have any periodontal disease where the gums are inflamed down deeper, then the dentist will usually have you come in every 3 months for a deep cleaning. And you're keeping yourself healthier in every way by keeping your teeth clean, brushing and flossing every day.
Because it's how it gets through the rest of the body.
Right.
It's going to affect you as well.
Right.
Yeah. So that's, sometimes it's something we can't think of everything being related to something else.
Right.
Yeah, that it could affect
It's
us.
like that old song, you know, the elbows connected to the
the teeth are connected to the blood vessels and everything, and every other part. Yeah. So okay, well, actually, we got another one there that this is the one we think of the most common with diabetes is diet.
Right.
And I know you do discuss that. You know.
Yes, I brought a little handout that's a picture. There is something that we teach called the plate method. If you have a computer, you can put in the search engine, plate method for diabetes, and this will all pop up for you. There's a lot of information. That's the easy way to remember what good portion sizes are. So I have a pamphlet here that has a great graphic for you. Oops, here we go. So this is what a plate would look like when it's set up in a healthy manner for people living with diabetes. So we start out with a 9-inch plate. A lot of the plates today are 11-inch.
Isn't that something? Yeah.
So you measure from the inside rim of the plate, not the little ridge on the outside, and that's more likely to be a 9-inch plate. And you split your plate in half, and half of the plate is filled with non-starchy vegetables. So that includes just about everything except beets, carrots, or I'm sorry, not carrots, beets, peas, potatoes, and corn.
Okay, those are the starchy.
Those are the starchy ones. Everything else, broccoli, zucchini, green beans, mushrooms, carrots, bell peppers, lettuce, kale.
All that green.
Yes,
Yeah.
broccoli, cauliflower. Those things are all low carbohydrate vegetables. So you want to start your plate with about 2 cups of those non-starchy vegetables. Those will not raise your blood sugar. Next, you want to have 3 ounces of protein. That protein can be fish, it can be chicken, it should be fish at least once a week. And then you can also use beef or pork, nuts, and beans. Beans get a little tricky because they have carbohydrate, and that's what raises our blood sugar. So the last fourth of the plate is for your carbohydrate. And we recommend that you have whole grain carbohydrates. That would include brown rice, whole grain pasta, potato, corn, peas. Let's see, what am I leaving out? So those are usually 1/3 to 1/2 cup serving. And then in addition, you are allowed to have a piece of fruit or a serving of fruit. So different fruits have different amounts of sugar. There are apps online where you can go on to look at how much carbohydrate is in your fruit. For instance, a banana, a serving of banana would be a half a banana. Serving of melon would be a 1/2 cup of melon, whereas you can have a 1 1/3 cup of strawberries.
Oh, okay.
Or a full cup of blueberries, or a whole orange or a whole apple.
So there's differences, yeah.
So that's your second serving of carbohydrate. And then the last serving of carbohydrate is recommended to be a milk serving. And that would be 8 ounces of low-fat or non-fat milk.
What about cheese?
Cheese would fall under fat.
Oh, not the...
It would not fall
carbo.
under protein. It falls under fat. And so we recommend that you eat low-fat cheese in a serving that's about 1 ounce. And they say that 1 ounce serving is about the size of your thumb.
Average thumb.
So if you look at the store for the non-fat string cheese, if you happen to like cheese, that's a good one. There's 2.5 grams of fat in that and 80 calories. I like to use those for a snack in between meals. That's a little longer than your thumb, so it might be from down here, but it's about the width around of your thumb.
So there's no, they don't give you any credit for protein in the cheese, right?
For the cheese is considered a fat.
It's a fat, yeah, okay.
And then your protein serving at 3 ounces would be about the size of the palm of your hand. So I don't mean 6'6" huge man, but the average lady's hand would be about a 3 ounce serving, and it would be as big around as the palm of your hand, and then the width of a deck of cards, and that would be roughly 3 ounces. Really, the best way is to weigh your food to make sure that you're getting the right amount, particularly if you're working on weight loss. And then a 1 cup serving is roughly the size of your fist.
So, well, that's very good. That's you always have those with you.
That's the other thing I wanted to teach about diet. is that I showed you here that the ADA recommends these 3 servings of carbohydrate. Every 1 serving of carbohydrate has 15 grams of carbohydrate in it. So you can look on the labels. I hope you can see this. You can look on a label and you'll see it says total carbohydrate. And if it's somewhere close to 15 grams, then you know you have 1 serving of carbohydrate. So that would be 1/3 of a cup of rice. For instance, if somebody with diabetes absolutely loves rice, they don't care for milk and they don't care about having any fruit, then they could substitute and have a full cup of rice, and that would be 3 servings of carbohydrate.
Yeah. you could do it.
Again, this is when the sugar after eating or postprandial blood sugar is important. And you want to measure that about 2 hours after eating. And you can see when you eat 45 grams of carbohydrate, how high your blood sugar goes. And it should be under 180. Your doctor will give you your target range, but that's the range that the ADA recommends, is under 180 2 hours after eating.
2 hours after eating.
If it's over 180, you can try having 2 servings of carbohydrate. If it's still over 180, you can reduce to 1 serving of carbohydrate. And that's information you can share with your doctor that'll be very helpful for deciding on your medications.
I see. Okay. So you do the best you can by regulating your diet, but sometimes people would still need medication if it,
Absolutely.
even with a healthy
Absolutely.
diet. Yeah,
And diabetes is progressive, so we may have it well managed, and that may change over time.
That's true.
And we may need more medication or different medication.
Yeah, so it is. How often would a person with diabetes see their doctor? I mean, if it's pretty well controlled?
Well, if it's real well controlled and your blood sugar is, your hemoglobin A1C is under 6.5 or 7, then the doctor would likely want to see you every 6 months.
I see.
If your sugar's higher than that, they should see you, or would probably want to see you quarterly, every 3 months.
Okay, so that's a good judge of that. So then we're gonna get into the E's, exercise and eye exams.
Yes.
Yeah.
Okay, so first of all, with eye exams, diabetes can lead to eye disease. And when we have our dilated eye exam every year, it's recommended at least once a year. When we have that dilated eye exam, the eye doctor can tell us whether our diabetes is affecting our eyes or not. And sometimes it will be affecting our eyes and we won't notice it. We won't have vision problems until there's more damage done. So the eye doctor can catch it early while your vision is still good or better than it would be. And the things that people have trouble with in regard to their vision are glaucoma, cataracts, and retinal bleeding. So the doctor can detect those things very early when they dilate your eyes and look into your eyes to check them. And there are treatments to spare your vision. But the best treatment of all is controlling your blood sugars.
Right. That's what's going to prevent
That will
or slow
prevent
it down. at
Prevent
least.
it.
Yeah.
Yes. Well-controlled diabetes is the leading cause of nothing.
Right.
So if we keep our hemoglobin A1Cs down low and our after meal blood sugars down under 160 or under 180, then we're going to avoid the things that diabetes cause to go wrong in our bodies.
Right. Okay. Well, we're edging up to about the last 5 minutes, so we're going to kind of
So we were going to talk about
Yeah.
exercise.
Yeah,
you
and
said,
maybe
right?
briefly exercise, and then we'll touch on foot exams. Foot
Okay.
checkups. Yeah.
So, exercise. We should all be exercising, and people with diabetes, what is recommended is a minimum of 30 minutes, 5 days a week. Now, I'm not recommending that someone who has not been exercising at all get up and do 30
Right,
minutes.
all at once.
So you want to start very slowly. First, speak to your doctor, make sure that you're well enough, and then start slowly. I've had people that only walk in the house and they've agreed to start walking to the mailbox 5 days a week. And then after a week or two, they feel stronger and they can walk 2 houses down and come back.
Just small changes.
So small changes are important until you can reach that goal. And then we also recommend exercises that strengthen your muscles. So you can do something as small as getting 2 soup cans and pushing the soup cans up to strengthen your arms, or curling them up to strengthen your arms, or even with empty hands.
Yeah. So everybody can do something.
Everybody
as
can
far
do
as
something.
Exercise. And there's a lot of programs here in the village, of course,
Yes.
that you could go to if you wanted to do it that way.
Yes.
Yeah. So that's a really important one there. And then feet, getting your feet
Yes, our
examined.
feet.
Yeah.
We need to, as people living with diabetes, ask our health provider every time we go to look at our feet. I just recommend that my diabetes patients walk into the doctor's office, take off their socks and shoes,
Remind them, huh?
in order to remind them to look.
Yeah.
Because a lot of times people have trouble bending over to see the bottom of their feet.
That's true.
The other thing you can, and you should be checking your feet. People should be checking their feet every day
Yeah.
in the mirror if you can't bend over to see them.
To see if you can see the bottom of your foot, or see if there's a, and you're looking for sores, or?
You're looking for sores and calluses.
Okay.
Yeah, calluses can have sores
Also.
underneath them.
Okay.
And when we have diabetes neuropathy, then we're unable to feel that there's a sore under
That's
there.
where that kind of numbness, yeah, you can't feel something.
And people should know too that they need to wear very comfortable, very sturdy shoes. And Medicare pays for a new pair
That's true.
of shoes for people with diabetes
There are
every
special
year.
shoes.
Special shoes every year.
Right.
So see your podiatrist.
Right, right. So we're coming up to our summary here. So this is a kind of a summarizing everything we talked about today. And of course, we want to end on a note of hope that you can participate in your care, and you can manage your diabetes.
That's
Yeah,
right.
That's what you want to emphasize here.
Yes.
Yeah.
Diabetes that's well managed
Right.
does not cause all
Doesn't
the
do the
problems
harm.
we hear about.
Right. And you're available, you and other nurse case managers and diabetic educators through Monarch
That's
are
right.
available to help. And most of it you're going to do telephonically and out in the community sometimes when I have a program for you. So everyone's welcome to call me to find out when we're having something, or how to get in touch with someone like Debbie to call, and talk to you about your personal challenges with this.
Yes.
And so anyway, we're really happy that you came today.
Thank you.
I think we covered a lot of territory here. And we want everybody, of course, to know, come to Florence Sylvester and see me there, and or call, and I can make sure that you get some of this literature out to you if you're interested in that. And thank you again for joining us for Senior Focus.
Yes.